How does pregnancy alter the thyroid feedback loop? Imagine your body is like a finely tuned orchestra, and pregnancy is a new conductor stepping in to change the tempo. During pregnancy, many things happen inside your body to support both your health and the developing baby, especially in how your thyroid gland functions. Normally, the thyroid feedback loop involves the hypothalamus releasing thyrotropin-releasing hormone, which prompts the pituitary gland to produce thyroid-stimulating hormone. This TSH then tells the thyroid to produce thyroid hormones, mainly thyroxine and triiodothyronine, which help regulate metabolism and energy. But pregnancy shifts this balance in several important ways. Early in pregnancy, especially during the first trimester, a hormone called human chorionic gonadotropin, or HCG, surges. This hormone is produced by the placenta and shares a similar structure to TSH. Because of this similarity, HCG can bind directly to TSH receptors on the thyroid gland, stimulating it to produce more thyroid hormones. This means that even without the usual signals from the hypothalamus and pituitary, the thyroid gets a boost. As a result, TSH levels often drop during early pregnancy because the increased thyroid hormones provide negative feedback to the pituitary, telling it to slow down TSH production. At the same time, pregnancy causes a big increase in estrogen levels. Estrogen prompts the liver to make more thyroid-binding globulin, or TBG, a protein that binds to thyroid hormones in the blood. When TBG levels rise 2 to 3 times, more thyroxine and triiodothyronine are bound up, leaving less free active hormones circulating in the blood. To keep enough free hormones available for both mother and baby, the thyroid responds by producing more total thyroid hormones. This adjustment ensures that despite the increased binding, the levels of active hormones stay adequate. Pregnancy also affects how the body handles iodine and thyroid hormones. The kidneys become more efficient at filtering blood, which increases iodine clearance from the body. Additionally, enzymes in the placenta help break down thyroid hormones faster. These changes mean the thyroid has to work harder to produce enough hormones to meet the increased demands. Sometimes, the thyroid gland enlarges slightly as it ramps up production. The placenta itself plays a role in regulating maternal thyroid hormones by releasing factors that influence thyroid function. Pregnancy also involves immune system changes, which can sometimes affect autoimmune thyroid conditions like Hashimoto's or Graves' disease, causing variations in thyroid test results. All these adjustments mean that the normal set points of the hypothalamic pituitary thyroid feedback loop are temporarily shifted during pregnancy. TSH levels are generally lower, especially in the first trimester, because of HCG's stimulating effect. The body adapts to maintain stable free thyroid hormone levels despite the increased production of binding proteins and faster hormone metabolism. Understanding these changes is crucial because thyroid function tests during pregnancy need to be interpreted differently from non-pregnant states. If thyroid hormones are not properly managed, especially in women with pre-existing thyroid conditions, it can affect fetal development, particularly brain growth in early pregnancy. That's why regular monitoring and appropriate treatment are essential for pregnant women with thyroid issues. In essence, pregnancy transforms the thyroid feedback loop through HCG stimulation, increased hormone binding, faster hormone breakdown, and placental influences. These modifications help meet the heightened metabolic and developmental needs of both mother and baby, ensuring a healthy pregnancy. Always remember to consult healthcare professionals for personalized advice and management during pregnancy.